Hello everyone. Today our topic of discussion is a very common drug which is called PROTONIX. So PROTONIX is a PPI which is used both inpatient and in outpatient setting. So we will discuss the mechanism, uses and common side effects associated with PROTONIX. So first, what is the mechanism? So PROTONIX is a drug which will inhibit hydrogen potassium ATPase pump. It will inhibit hydrogen potassium ATPase pump which are present in the parietal cells of the gastric mucosa, especially in the body of the stomach. So it inhibits this pump which will decrease the formation of HCl. What are the common uses of PPI PROTONIX? So the common uses are GERD, dyspepsia, Barrett esophagus, erosive esophagitis. It is a part of triple therapy for H. pylori eradication. It is a common drug used for eosinophilic esophagitis. It is used in peptic ulcer disease, NSAID-induced ulcer, stress ulcer, and it's used in upper GI bleed. What is the mechanism? So the onset of action of this drug, it starts in 15 to 30 minutes and it reaches its maximum in about 2 hours. The duration of this drug is either oral or IV is 24 hours, the duration of action. It is mostly metabolized in the liver and excreted in urine 70% and in stool about 20%. Now, what are the common side effects associated with this drug? So this drug is used in inpatient and outpatient setting a lot, and the long-term use of this drug is associated with a lot of side effects. So let's look at those side effects one by one. So number one is immediate and delayed hypersensitivity reaction. So in terms of immediate reaction, it can cause urticaria, angioedema, and anaphylaxis. In terms of delayed hypersensitivity reaction, it can cause rash, pruritus, drug-induced eosinophilia. It can also cause Stevens-Johnson syndrome. PPI can also cause systemic lupus erythematosus. And in these patients, they will have positive ANA, positive anti-Rho or anti-lambda antibody. So this side effect is reversible if you stop this drug for 4 to 8 weeks. The presentation of systemic lupus erythematosus is it presents with rash, arthralgia, cytopenia. So rash will be bullous all over the body, and it can also cause some skin necrosis, focal skin necrosis. The next side effect is it can commonly cause GI infection. PPI decreases the acid in the stomach, and when the acid is low, there will be increased formation of C. diff spore and other GI pathogen colonization in the stomach, which increases the risk of C. diff infection and can increase the risk of Salmonella, Shigella, and Campylobacter. The next side effect is it can increase the risk of fractures. How the mechanism is decreased acid in the stomach will increase gastrin level in the blood, which will increase parathyroid hormone, which will increase resorption of bone, which will increase risk of fracture. The next side effect is it increases the risk of hypomagnesemia. What is the mechanism? So decreased acid in the stomach will result in decreased absorption of calcium and magnesium, which will increase risk of low magnesium. Severe hypomagnesemia can cause tetany or even seizure. So hypomagnesemia usually occurs if you use PPI for greater than 1 year, and this side effect is reversible if you stop this treatment for 1 week. The next side effect is it can cause reversible vitamin B12 deficiency. What is the mechanism? So PPI causes digestion of dietary protein bind to B12. It can cause digestion of dietary protein which are bound to B12, which will result in malabsorption of B12. So this usually happens if you use PPI for 2 to 3 years, and reversible if you stop this medication. The next side effect is acute interstitial nephritis. So this is a rare side effect, and it is reversible if you stop this medication for 6 months. It can cause AKI, which is diagnosed on biopsy, acute interstitial nephritis, and one of these findings, which is fever, rash, eosinophilia. The next side effect is it can cause fundic gland polyp. Decreased acid will increase gastrin, which will cause hyperplasia of the fundic gland, can lead to polyp. Next is CNS side effects, because PPI can cross blood-brain barrier and can cause headache, dizziness, and vertigo. The next one is it can cause leukopenia and thrombocytopenia. This side effect is rare in less than 2% of the patient. Another side effect is PROTONIX, which is a PPI, can cause hepatitis, which is again not common in less than 2% of the patients. So this was a mechanism, uses, and common side effects of PPI, which we commonly use during outpatient and inpatient setting. So always keep them in mind to keep our patients safe, and try to stop the drug as early as possible if the patient don't need the medication. Thank you very much. Have a nice day.